Gentlemen, let's have an honest conversation. If your health, confidence, and long-term vitality matter to you, then this is one discussion you shouldn't miss. There are 10 common habits, many of them surprisingly ordinary, that can gradually weaken erections, reduce sensitivity, and quietly affect your sexual health over time. My goal isn't to frighten you. It's to give you the knowledge you need to protect yourself. When you understand what damages your body, you can make choices that preserve your confidence, performance, and quality of life for years ahead. Before we begin, I'd appreciate one quick favor. Please like this video so more men can benefit from this information, subscribe if you haven't already, and leave a comment telling me where you're watching from today. I'm always encouraged to see men from around the world taking an active role in protecting their health and supporting one another through education and awareness. One important fact many men never hear is that your penis can reveal changes in your overall health long before other parts of your body do. Think of it as an early warning system. When erections become weaker, less frequent, or more difficult to maintain, it may be signaling problems with blood circulation, hormone balance, or even cardiovascular health. These changes should never be dismissed as simply getting older. In many cases, they provide an opportunity to identify and address health concerns before they become far more serious. My name is Dr. Leah, and for years I have focused on helping men improve their sexual health, hormone balance, and overall well-being. I've worked with countless men experiencing erectile dysfunction, prostate conditions, and age-related changes, and I've seen how small lifestyle improvements often produce remarkable results. Let's begin with the first habits you should avoid if you want to maintain healthy erections and lasting confidence. The first mistake is ignoring changes in your erections. Many men assume weaker erections are simply an unavoidable part of aging, but that's often not the case. An erection depends on healthy blood flow, and the arteries supplying the penis are much smaller than those serving the heart. Because of this, they often show signs of circulation problems much earlier. A noticeable decline in erectile quality may be your body's first warning that your cardiovascular system needs attention. Studies have shown that erectile dysfunction can appear several years before more serious conditions such as heart disease become obvious. That's why it's important not to dismiss these changes or hope they'll disappear on their own. Instead, treat them as valuable information. Paying attention early gives you the chance to improve your health through proper evaluation, healthier habits, and timely treatment. Protecting your erections often means protecting your heart and your future as well. The second mistake is experimenting with unsafe home remedies or internet tricks that promise instant results. Every year, I meet men who have injured themselves after trying unproven methods they found online. Applying harsh substances, using homemade stretching devices, or placing tight objects around the penis can cause torn tissue, nerve damage, scarring, and even permanent erectile problems. Some injuries become so severe that emergency treatment is required to prevent lasting complications. If you decide to use any device designed to support erections, make sure it is medically approved and follow the manufacturer's safety instructions carefully. Never improvise with household objects or products that were never intended for intimate use. Protecting your sexual health means avoiding unnecessary risks. Reliable medical advice will always be safer than viral internet trends or miracle cures. Your body deserves evidence-based care, not dangerous experiments that may leave lifelong consequences instead of lasting improvements. The third mistake is overlooking basic hygiene. It may seem simple, but poor intimate hygiene remains one of the most common preventable problems affecting men's health. If you're uncircumcised, gently pull back the foreskin during bathing, clean the area with warm water and a mild cleanser, rinse thoroughly, and dry the skin before replacing the foreskin. This routine helps prevent the buildup of natural oils, dead skin cells, and bacteria that can lead to unpleasant odors, irritation, inflammation, or infections. At the same time, avoid scrubbing aggressively or using harsh soaps with strong fragrances. These products can remove your skin's natural protective barrier, leaving it dry, irritated, and more vulnerable to damage. Healthy skin depends on balance, not excessive cleaning. A simple, gentle routine performed consistently is usually all that's needed to maintain comfort, reduce infection risk, and support long-term penile health throughout every stage of life. The fourth mistake is ignoring warning signs such as pain, bleeding, unusual lumps, or sores. These symptoms should never be considered a normal part of aging or something to simply wait out. Pain during erections or intimacy, blood in the urine, persistent swelling, or any new growth on the penis can be early signs of infection, kidney stones, inflammatory conditions, or, in rare cases, penile cancer. The sooner these problems are identified, the easier they are to treat successfully. Delaying medical care often allows the condition to worsen while increasing unnecessary anxiety and uncertainty. If something doesn't look or feel right, trust your instincts and arrange an examination with a qualified healthcare professional. You deserve respectful, judgment-free medical care that addresses your concerns seriously. Seeking help early is not a sign of weakness. It's one of the smartest decisions you can make to protect your health, confidence, and long-term quality of life. The fifth mistake is taking unnecessary risks during intimacy. Confidence should always be matched with safety. Although uncommon, a penile fracture is a genuine medical emergency that happens when an erect penis bends suddenly with significant force. Men often describe hearing or feeling a sharp pop, followed immediately by severe pain, swelling, bruising, and a rapid loss of the erection. If this ever happens, seek emergency medical care without delay because prompt treatment offers the best chance for a full recovery. Another simple way to reduce injury is by using adequate lubrication during sexual activity. Dryness can occur for many reasons, including stress, medications, hormonal changes, or normal aging, and it doesn't necessarily reflect your partner's level of interest. Using a quality lubricant reduces friction, improves comfort for both partners, lowers the risk of skin tears, and helps create a safer, more enjoyable, intimate experience while protecting your long-term sexual health. The sixth mistake is exposing your testicles to excessive heat for long periods. They are located outside the body because they function best at a temperature slightly lower than your core body temperature. Spending too much time in hot tubs, placing a laptop directly on your lap, or keeping heat-producing devices close to the groin for extended periods may interfere with normal sperm production and hormone function. Over time, repeated heat exposure can reduce fertility and may contribute to lower testosterone levels in some men. Fortunately, preventing this is simple. Use a desk instead of balancing a laptop on your legs. Take breaks from prolonged sitting and avoid unnecessary heat whenever possible. Another habit to avoid is using excessive force during masturbation. Consistently gripping too tightly can gradually reduce sensitivity, making natural intimacy less satisfying. Gentle stimulation with adequate lubrication helps maintain normal nerve responsiveness and supports healthier, more enjoyable sexual function over the long term. The seventh mistake is continuing to smoke, and the eighth is allowing stress and self-criticism to take control. Smoking damages the delicate lining of your blood vessels, reducing the production of nitric oxide, the natural chemical that allows penile arteries to relax and fill with blood. Over time, this weakens erections and increases the risk of serious conditions, including bladder cancer and cardiovascular disease. At the same time, many men become their own worst critics after experiencing occasional erection problems. One difficult experience can quickly turn into ongoing anxiety, activating stress hormones that narrow blood vessels and make future erections even harder to achieve. Instead of blaming yourself, recognize that every man experiences occasional changes. Focus on improving your health, communicate openly with your partner, and seek medical advice when needed. Protecting both your physical and emotional well-being is essential for maintaining lasting confidence, healthy relationships, and satisfying sexual function. The final mistake is believing you no longer need regular erections or intimate activity as you get older. Healthy erections deliver oxygen-rich blood throughout the penile tissue, helping preserve elasticity, sensitivity, and normal function. When erections become rare for long periods, those tissues receive less oxygen, which may contribute to stiffness, reduced sensitivity, and gradual changes in size or performance. Maintaining healthy circulation through intimacy, whether with a partner or through safe solo stimulation, supports long-term tissue health. Alongside this, prioritize regular exercise, nutritious meals, quality sleep, stress management, and routine medical checkups to keep your cardiovascular system and hormones working at their best. Some men may also benefit from evidence-based supplements after discussing them with their healthcare provider. Most importantly, never view erection problems as a source of shame. They are valuable health signals. Listen to your body, take action early, and you'll protect not only your sexual health, but your overall well-being for years ahead.